Our top priority remains getting the vaccines out to those who need them most as quickly as possible. Our first shipments of a very small number of doses could arrive as early as next week. But we're still very far, and I got to repeat that, very far from having the millions of vaccines we need for mass immunization. The federal government, as I've said in the past, the federal government, they're responsible for what type of vaccines we're getting, how much we're getting, and when we're getting it.
We want to get at the most vulnerable population and then get at the health workers across Ontario who really are vulnerable just in a different way. And in some cases, those two priorities are going to mesh somewhat because, for example, when we go at the most vulnerable and we go into a long-term care facility to look after the residents there who have suffered so badly from this horrible epidemic, we are obviously not just going to do the residents that are there with a vaccination program. We're going to have available for the people who work there, the personal care workers, the healthcare workers, and those essential visitors that are required to look after the people in those homes also. So in our phase one, we want to get the vulnerable and the healthcare workers, and we know that we will have more demand in those two groups than we will have vaccines to satisfy. So we can't do it all at once, and what we have committed back to the Premier and to Cabinet is that our decisions in the short term, based on when the vaccines arrive, whether it's 100,000 next week or 250,000 down the road further on or 500,000 2 weeks after that, we will make the decisions as to where we go based on the best data that we have.